like to call this meeting, the Alexander County Board of Commissioners, into order. And this is the second day of March 2026. And at this time, we'll have the invocation by Vice Chairman Josh Lael, the pledge allegiance by Commissioner Ronnie Reese. If you would, please stand.
Heavenly Father, thank you for this day. Thank you for allowing us to come together this evening to try to make smart decisions that are led by you to advance Alexander County. Dear God, thank you for all the gifts that you give us. Thank you for all the blessings we receive each day. Please be with our local law enforcement, our local emergency services folks, our state police, and as well as the military and armed forces. Dear God, please especially right now put a hedge of protection around our military as they're in the Middle East and dealing with war. Dear God, be with us, help us to make good decisions, and we will give you all the glory. In your name we pray. Amen.
Amen.
Attention, salute, pledge. I
pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you. At this time, does any commissioner have any reports?
Mr. Chairman,
Yes, sir.
I don't have much, but I went to the fire chiefs meeting the 19th, and everything seemed to be going well, and they're working on their budget for this year, and they are going to be using the new facility down at the fairgrounds. Going to have a junior firefighter training day down there on May the 16th from 8 till 5, so it's good to see that they're using that facility. And it's going to be open to the surrounding counties too that day.
Very good.
Mr. Chairman, if I may, Chairman Yoder and our County Manager Justin Mundy and myself attended the NACO conference last weekend. NACO is the National Association of County Officials in Washington, D.C. And I have attended that conference for several years in a row, as well as Chairman Leighton Yoder and several of these other gentlemen have been in the past couple of years. This year, we were able to get some FaceTime with Senator Ted Budd and Representative Virginia Foxx, which we haven't always been able to do when we were up there. And I just wanted to kind of go over a couple of things. I feel like the trip to DC was successful. I feel like it was productive. Couple of the things that we talked about with our representatives, and when you think about it, those folks are very powerful people. If you kind of think about it, they're some of the most powerful people on earth. And we at the county level, a lot of times, at least for myself, we're not in the same class, obviously, as a U.S. Senator or a U.S. House member. But a couple things that we talked about, we went up there with the plan to discuss some things pertaining to economic development that I don't want to say we're struggling with in Alexander County, but we're kind of behind the 8 ball just by happenstance. We were talking to them about the new market tax credit and economic opportunity zones, and basically what those things are is they are federal programs for dedicated area, well, not dedicated, but certain areas, a lot of rural areas in the country, where there is federal assistance for a new industry. And by happenstance, somehow our industrial park is on the wrong side of the street. And so we're working on getting that corrected. Had good conversations with Senator Budd, as well as Representative Fox about that. The other thing that another thing that we talked about, and this is an example of, this is an example of what happens to the county, what happens to the county level government. HR 1, which is known as the Big Beautiful Bill, a couple of the major things that are included in that are changes to Medicaid and SNAP. And I know at least for myself, I am completely in favor of working to reduce and eliminate fraud or abuse of those programs. But here's the kicker. North Carolina is one of 10 states where SNAP or food stamps is administered at the county level. 40 of our states, it is administered at the state level. And Medicaid, we are one of 9 states that administer Medicaid at the county level. That being said, part of the changes that are coming, include eligibility verification twice a year, which I agree with, because I do feel like there are some folks that take advantage of the system. Where currently it is, there's eligibility determination once a year. Well, doing it twice a year is double the work. And from the county's perspective, that's basically an unfunded mandate. We've got to figure out how to, and so we talked to those folks about, potential budget shortfall that could be created, by the increased workload at the county level. And so I just wanted to say, I feel like we had a good, successful trip. We at least got to air some concerns. One thing that was said, actually by Representative Fox, but, and I don't think a lot of people know this, and I don't know how to get this word out, but, she basically said to us, if there's some aspect of the federal government that is not doing its job correctly for you, call. Don't wait to call. Call your rep. Call your senator's office. They have staffs to deal with things like that. And, and she made a comment, if it's the Postal Service, if it's the IRS, if it's whatever, if you have an individual issue that you can't, where you feel like the federal government's not doing its job, that's what they're there for. And just thought I'd, share that little commercial, because I know our folks in Raleigh work hard, or not Raleigh, our folks in DC work hard, our folks in Raleigh work hard too. But anyway, Mr. Chairman, that's all I have.
Okay, thank you, sir. And to tag on to that, she really emphasized the fact to call immediately. Don't let it drag out, because when things drag out, it doesn't do anything. It continues to cause a problem. And she really emphasized, make sure you stay in contact with them and get things straightened out at that time. The other thing that we did while we were in Washington, it's sort of become a tradition for this group of county commissioners that each year when we go to the NACO conference, we try to lay a tomb at the unknown soldier. And I think other than Kent, I don't think Kent's got to do it, but I know the rest of us have. And I hope that next year Kent can go and he'll be able to do it also. It's a very moving ceremony when you're there and you get to lay that wreath on the tomb of the unknown soldier. It's just unbelievable. Mr. Justin Mundy, our manager, he and I were the ones that placed the wreath on the tomb. And yes, it's pretty solemn when you're standing there and you've got these military personnel that are extremely dressed, well-dressed, and one of them was from Wilkes County. He was the one that we first met when we were there. But when you're standing there and you place that wreath and then they tell you to turn around and you turn around and they play taps, I'm gonna tell you, after you've ridden through that cemetery and you looked around and seen all those headstones, and then you're looking at those two stones there, or the stone there where the unknown soldiers are, it's a very moving ceremony. And we do that in honor of the citizens of Alexander County, our military personnel who have given all, and to those who are in active duty. And then when we get home a week and a half later, we find out the situation that's going on overseas. And our military personnel, we need to be extremely proud of them, look after them and take care of them. That's one of the things that Representative Fox mentioned there, to make sure that our veterans, that they're getting the treatments that they need. And so when you see these veterans, and make sure you tell them thank you for what they've done. And on another note, we had one of our employees from the planning director's office, Patrick Greach, our planning director. He appeared on Jeopardy on February the 26th. I thought that was very, very good for Alexander County. And it's very good for him. And it gave us a lot of recognition. And I asked Gary Herman if he would, who is our public information officer. Gary said that we had 70,000 views that week about Alexander County. And there was 266 reactions, 29 comments, and 72 shares. And on a typical Facebook day, we probably average about 5,000 views. And these stats show that our residents were excited to hear about Patrick's appearance on the popular game show. And we too are proud of Patrick's performance, and we're glad that he put Alexander County on the national map and national TV. And if you see him, tell him he did a good job. I mean, that's got to be a hard show to go on, no matter how intelligent you can be when you're in front of the camera and you start getting questions fired at you. And you got to go beep, and about the time you go beep, the guy beside of you's already beeped it. So if you see him, tell him you're proud of him, because I think that's extremely rewarding for him and put Alexander County on the map. Okay? Oh, excuse me. Mr. Manager, is there anything you'd like to say about your trip to whenever we were there and laying the wreath?
No, just ditto on the comments already made. Like Mr. Lill said, I think we had a very productive trip. And as Chairman Yoder said, it was a very touching and moving experience to lay that wreath at the tomb of an unknown soldier. And those guys they can't be thanked enough for what they do for our country. And we just need to keep them in our prayers.
Thank you, sir.
Mr. Chairman, one more thing. This is, the Alexander Central High School Lady Cougars basketball team is playing tonight in the 4th round
Yep.
of the state playoffs at 7 o'clock. And I'm the father of a JV cheerleader, and so I have been to quite a few Cougar basketball games, and just to be honest, we typically go for the JVs and stay for the girls varsity, and then by the time that's over, it's time for, if we do have some of the kids with us, it's time for them to go to bed, and if not, it's time for me to get home to try to help get them into bed. But the AC girls varsity basketball team, they're impressive. I'll say they have been ranked #1 in 6A for a good portion of the season. And say, very proud of that group of very talented young ladies.
Anyone else? I'd entertain a motion to adopt the agenda as presented.
Make a motion to adopt the agenda as presented to us.
Second.
Motion's made, seconded. Any discussion? There being none, all those in favor, raise your right hand. All opposed likewise, motion carries. Public comment, Madam Chairman, I don't believe we have anybody. Okay. Item number 7, NCAA District Meeting Informational Video, excuse me.
Hello, Commissioners. I'm Wallace Nelson, NCACC President and Perquimans County Commissioner. I want to take a moment to speak directly to my fellow commissioners and county leaders about our upcoming NCACC district meetings in early March. Quite simply, your presence matters. We're at a critical moment for counties. The decisions being made at the federal and state levels are having real, immediate impacts on our local budgets, our services, and the people we serve. District meetings are more than routine gatherings. They are working sessions that shape how we move forward together. On the agenda, we will be discussing updates on our presidential initiative, key association priorities, and important legislative developments. I want to especially emphasize the legislative updates. We'll be talking about H.R. 1 and its practical implications for our county budgets, especially related to programs like SNAP and Medicaid. We will also dive into ongoing property tax reform discussions at the General Assembly, which could significantly affect how we fund essential county services. These meetings are a great opportunity to hear from each other and to build stronger relationships with fellow commissioners in your districts. So please, join us to share what's happening in your counties, what's working, what's challenging, and where you need support. When attendance is strong, our message is stronger. When we are aligned, our advocacy is more effective. And when we learn from one another, we are better equipped to serve our counties. I know schedules are always busy, but I encourage you to make attending your district meeting a priority. Finally, I would like to mark your calendars for March 27th for our first forum on our presidential initiative, Counties Care, Access to Health Care. We will be meeting in Raleigh to talk about the importance of health care and especially our rural hospitals. More information will follow, but I wanted to make sure you have March 27 on your calendars. So let's come together and lead together for our counties and for the people who depend on us every day. Thank you for all you do for supporting your association. I look forward to seeing you there.
And the meeting for our district, Districts 13, 14, and 15, will be in Burke County on March the 5th. And I know that some of us already plan to attend. So thank you. Item number 8, Cost of Community Service Study Report, Pamela Bowman, Soil and Water District Director, and Dr. Jeffrey Dorfman, NC State University Economics Professor.
All right, thank you. I just wanted to thank you for having us again and basically introduce Dr. Dorfman. The Soil and Water Office was able to receive a grant from the North Carolina Department of Agriculture, the Agriculture Development and Farmland Preservation Trust Fund, I believe is the full title of that grant. But we got that a year and a half ago, and we were able to connect with Mr. Dorfman from NC State. He's an economics professor there, and he was able to do the study for us. It's basically, he's going to go over it, but it's basically to see what different land uses bring into the county versus what they cost the county. So I'm going to pass it over to Mr. Dorfman.
Good evening, and thank you all for having me. I just want to also say thank you for laying the wreath at the Tomb of the Unknown Soldiers. My son-in-law was 7 years with nuclear submarines in the Navy, so I appreciate it. Also kind of glad he's out right now. So I'm going to explain what cost of community service studies are and tell to you about the results from the one I did here in Alexander County. basically, I take the entire county budget and we reorganize all the revenue by who paid it in. So when you pay your property tax, if you pay sales tax at the grocery store, if you sign your kid up for T-ball and there's a $20 registration fee, we count that $20. You get a parking ticket, we count that. We count all the money businesses pay in, we count all the money farms pay in. So we divide all the revenue into those three pots. Then we take all your service expenditures and we divide them into the same three spots. So some of those are easy. Everything you spend on schools goes into the residential pot. Some things are tricky that are being used by both businesses and people. And so what we did was we did a survey and we asked all your department heads and they helped. So this isn't just me sitting in Raleigh figuring out what I think you guys are doing. This is your department heads filling out forms explaining where the money that they're spending is going. So which of these three buckets is getting that money? Let's go to the next one. Well, this shows you sort of national averages. So on a national average basis, residential development pays in about 85 cents for every $1 it gets back. So essentially, we as individuals pay less in taxes than we get back in local government services. Businesses, you can see they're normally pay in quite a bit more than they get back. Okay, and so does farm and forest land. Now, this isn't necessarily a bad thing. The goal isn't for all those rectangles to be exactly $1 high, so everybody's paying the perfect amount. Because when our businesses pay in more than they get back, the businesses got that money from their customers, which in most cases are the same people that in the other rectangle are underpaying. So you kind of underpay as a resident your direct taxes to the local government, but you're paying some hidden taxes when you frequent local businesses, and so in the end, you're paying all the money. It's just a question of whether you pay it in a visible way or a less visible way. Where this does get important, though, is when a county grows. If your residential rectangle is less than $1, your business rectangle is more than $1, and you have lots of people moving to your county and moving into houses, and you don't get new businesses, then your budget's in trouble because you're adding short rectangles that aren't paying enough, and you're not adding any of those big rectangles to cover the cost. So what happens then is you have to raise the tax rate on existing residents. So the point of these studies is to show where you are so you can have that to help you in planning decisions and things like updates to long-range comp plan. So here's the actual Alexander County results. So Alexander County is doing a little better than normal on residential. You're getting 88 cents for every $1 people get back in services. Your commercial rectangle is actually very low at $1.03. So commercial's only paying in a little more than it gets back. And that has to do with the sort of businesses that you have. You actually have a fair amount of retail, and retail is not very beneficial from a sort of fiscal surplus point of view. What you really want is a big, well, even a small, sort of an ugly, nobody noticed, hidden away industrial facility that nobody thinks of at all, but pays wonderful property taxes, and the sheriff never has to go there, right? You think you're getting all that money from Walmart, but there's a sheriff's car there all the time, right? So it balances out. And you can also see, very importantly here, the farm and forest land rectangle is very tall. Farm and forest landowners are paying in more in taxes than they get back in services. And this accounts for all the property tax breaks that farm owners can apply for and receive. So this is already, that's incorporated in here. So even with those tax breaks, they're still overpaying. Next. All right, another way to look at this is with break-even home values. So on average, you are losing money on housing. You're only getting 88 cents for every $1 that you pay out in services. However, people building new homes in Alexander County tend to be building homes that are more expensive than your county average, right, the new growth. And so you can see here, as long as a house is worth over $170,000, it will pay enough in taxes to cover the services it received. Because as a house gets more expensive, it doesn't cost any more to send their kids to school or have them sign up for T-Bell or have their car drive down the roads. So you're spending the same amount for a less expensive or more expensive house, but the more expensive one pays you more taxes. So you break even on a $170,000 house, which most new houses being built here are going to be above that, which suggests that you can take that growth and you won't have to raise taxes on existing residents. So that's a big positive result from this study. Now I then show rectangles here for half a kid, 1 kid, and 2 kids. Service cost doesn't really change with how expensive a house is, but it changes a whole lot based on how many kids they send to the local schools. Because the absolute most important, expensive thing local government does is schools. I think a lot of residents don't realize how much of the budget is K through 12 education, but it's a lot. So you can see here, on average, a good planning number is about half a kid per household. Okay? Some people are old like me, kids are gone. Some people may send their kids to a private school. Some kids are under school age, so they're not going. So with half a kid per house, your break-even point is about $240,000. Okay, but if you let people with the whole kid move in, that house has to be worth $356,000, and a family with 2 kids that are attending the public school has to live in a $583,000 house to pay enough in taxes to cover the cost of sending those kids to school. Now, a fun thing here, if you want, is to ask, you'll have to do this, Mr. Chairman, because I'm not allowed to address the audience, but you can ask the audience if anybody wants to admit, looking at this chart, to having 3 or more kids. You got one?
He did. I got 7. I got 3.
Yeah.
Oh, I did have 3.
So pretty much you should just go around thanking all the other local taxpayers all the time.
I pay property tax on more than just my house.
We'll take it anytime.
So how can you affect sort of the height of these rectangles? One way is smaller lots. Okay? Service costs go down at 50% the rate of land use. So what that means is if you take a house that's on a 1-acre lot and you built an identical house on a half-acre lot, you, the county, will spend 25% less providing that house services. Because the school bus routes get shorter. There's less infrastructure to maintain. So it just, everything gets cheaper. You can also do that keeping the lots the same size, but clustering the houses together. So if you think about a cul-de-sac and building big pie-shaped lots, where the houses look like they're on small lots, but actually they all have like a whole acre of backyard. Right? So everybody can have the yard they want, but there's a lot less infrastructure to maintain. Not scattering houses everywhere. It's very inefficient when the school bus has to drive 2 miles down the road to pick up 1 kid. Sometimes I show a slide in this talk, but of pictures. Sorry, that was not a click. That was I used my hands to talk, and he thought I meant go on to the next slide. That was my fault. Sometimes I show a picture that's taken from directly above a neighborhood of houses in Orange County, California, Southern California, very close actually where my wife grew up. And you can see the houses almost fill the lots. They're 3,000 square foot houses, they're on 4,000 square foot lots. That neighborhood, the school bus stops at 3 different corners and it's full and it's off to school. And the school is only like a quarter mile away because you got a school about every mile because there's so many houses crammed in. We don't want to live that way necessarily, but it's very inexpensive and efficient from a local government cost of service perspective. You can design for lower service costs. Those lots I was talking about, pie lots, where everybody has small front yards and big backyards, reduces all the infrastructure you need to maintain. Infill development. And that doesn't necessarily mean right in downtown's Taylorsville. It can mean, well, there's already a subdivision there and there's already a subdivision there. And we've got this undeveloped land in between. If you're gonna develop somewhere, in between's a great place now. So that's leveraging existing infrastructure, right? If you've already got all that there, then it's much more efficient. So those are all things you can do to sort of help control your own fate. That's really the whole presentation. So now I guess I can do the symbol, and I'm happy to take any questions that you have.
It's pretty good. I mean, it's nice to get that information out to the folks that understand that, because it makes sense. The more cluster, the less the bus has to stop, less stop and go, and all the kids get on the bus at one time. You know, because especially in the rural community, the buses have to travel so far. And just like you say, I mean, on 16 every day, I see them, and they go maybe a mile, 2 miles before they make their next stop, you know. So it's very interesting information.
Thank you.
Yes.
Well, I would just say in defense of my 7 children, my kids have never ridden the bus. So I feel better about that. No, I'm sorry, no, to a serious note, and this is, you know, and this is something that I've tried, that I've tried to say, and I think we all have tried to say to the public, and, you know, Alexander County is small and rural. And when you look at our revenue to expenditures and compare those to Catawba, Davie, Henderson, and Yadkin, which you provided in, you know, in this, you know, residential, yes, we are a little high, you know, we're a little higher, which is not a good thing. But then commercial and industrial, you know, we're generating 30 cents, if I'm looking at this correctly. No, that's the median county, excuse me. I was just looking at how we compare, you know, how we compare to these other counties from a commercial and industrial standpoint, which we're trying, or, you know, we're doing absolute everything we know to do. You know, because Catawba County, commercial industrial, for every revenue per dollar, you know, they're taking in $1.85 for every dollar that they spend. Davie's taking in $2 for every dollar they spend in services. Henderson County's taking in $2.50 per dollar that they're spending in services. Yadkin County's taking in $2.63 per dollar. And, I mean, we're not even in that neighborhood.
No, you are, I've done over 20 of these studies. You are the second lowest on sort of commercial industrial, so how much you're collecting compared to how much you pay out.
Right.
But again, I think, I've actually done several studies on new market tax credits and how good that program can be. So I think you were exactly spot on in trying to get that issue with the side of the street fixed and get that going. That's the sort of thing that could easily bring in the type of projects that'll make your commercial industrial look better.
But what brought that to our attention is we missed an industry that was 10 times bigger than anything that's here now. And that was the reason. And it's going to Pitt County because free federal money, free federal money talks.
And assumedly, it was all just sort of an innocent mistake by somebody when they drafted the legislation. I mean, I doubt they meant to end the district.
No, it was yeah, I think we agree that it was just they had to put the line somewhere, and it just happened to be.
Should have been caught.
Happens to be White Plains Road on the wrong side. I mean, you know, but we're working on getting that fixed.
Yes, when they're like, what, 12 feet or something like that?
Well, I mean, it's the width of the road.
Width of the road, yeah.
It's crazy.
Yeah.
But
a good report. I appreciate the information and y'all working on this, and it brings to light a lot of things, so.
Thank
thanks a
you.
lot.
It does.
It's one of those things where, like I said, I do a lot of these reports. It's rarely a huge surprise to people, but it's nice having the numbers to back up the intuition you already had.
That's
correct.
correct. This is true. Very interesting information. We do appreciate it.
Well, and,
Absolutely.
and, I mean, just, you know, the break even on homes, $170,000. There are no homes being built
Right,
that are less than that.
yeah.
I mean, that's what I do for my day job.
And that's why I put it in there, because I don't want,
Right.
I don't want people to leave with the impression that since you're getting 88 cents per dollar, so residents are underpaying, that every new house means that you're losing more and more money and gonna have to raise people's taxes. So that's in there very specifically so people can see, no, look, the new growth right now is above that level. It's paying its way.
Oh, yeah, I mean, new homes are well over, I mean, average is well over $300,000.
Yeah, so you're fine at that half kit.
Yeah.
Yeah, you guys really should be in good shape. I don't think there's anything to be particularly worried about in this report.
I think, I think that we're in good shape myself. And then you go back and look at our budget and look at our, the things that we've tried to do. And the industries that's already gotten here, they have done really good and done really well, excuse me. And the other thing is that, even though you'd like to see new industry come in, which I think would be fantastic, maintaining the industry that you have and the growth that we're having in a controlled type environment makes everything so much better, so that you make sure that you don't put yourself in a bad situation by having growth, you know, so. And I think those things have been put in place. And I think it was interesting to also see that, what the farmland does and what comes out there, that, you know, so people understand that cost and the effectiveness that it has on a community, especially with us being an agricultural community.
A lot of people think that if you take farmland and put a bunch of houses on it, it must be good for the local budget, because look how much more property tax. Every one of those houses will pay more in property tax than the entire farm did. But it doesn't work that way, because, yeah, you get a whole lot of new revenue, and then a whole bunch of kids go to school, and you need more sheriff's patrol, and you need more of all the other services you provide. You need more libraries, you need more park acreage. So, in the end, it doesn't help.
It doesn't. She wants to.
If I may, a lot of these farms have hundreds of thousands of dollars worth of buildings on them that don't require any sheriff's department or any EMS to come to them. So, they pay taxes on those buildings every year.
Right. And then that's the whole thing. I mean, they're invested, they pay property taxes, and they're invested in the community, but it doesn't cost us that much to take care of that property. It does, the cost, the way I look at it, the cost for those farms is the same as, or less than what it is if you have a community where the bus stops and you don't have a lot of law enforcement and take care of it, because you don't have to provide the services to the farms like you do the housing developments or those areas that are together. It's less enforcement of things that you have to do, such as ambulance, fire, and all that. And, you know, with agriculture being as big as it is in this community, it's one of the things that's really, in the long run, has been a very good blessing to this community, you know, so.
Yeah, I think it really shows too that, and I think Mr. Herman would agree with me, if the cows are in a fight, the sheriff's probably gonna have to come out. And if the chickens are fighting each other, they're gonna be in that chicken house typically, you know, so, you know, that's a good thing, so.
It is.
Absolutely. Very good, very good
Thank you.
report, very good information.
Thank you very much.
Thank you. Okay, thank you, folks. We appreciate the information very much. Item number 9 on the agenda is the Alexander Courts Recovers Court abstract and request to Honorable Rob Young, District Court Judge, Judicial District 12.
Mr. Chair, Commissioners, County Manager, Mr. Clerk, I want to thank you all for putting us on the agenda. For those who don't know me, I'm Rob Young. I am pleased to be able to say I've been for a long period of time an Alexander County employee and was up here every day, Monday through Friday, doing work to make Alexander County a better place. I've been on the bench as my second term, and when I first ran, and of course the second time I ran, this first time unsuccessful, but the second time was, I said one thing, and that is that we have to address a substance abuse problem that is plaguing us all. Everybody I knew that I encountered in the court system, drugs were a big, big problem, ripping apart families, leading to deaths, leading to tragedy. And then when I was out on the campaign trail, same stories. Everybody had a story. My cousin, my sister, my aunt, someone I love is involved in this. What can we do to help? So that's always been a goal near and dear to my heart, to try to do something to help this county. And the opportunity arose several years ago. My first term, Judge Dale Graham said, well, we're gonna do something about this issue, and I'm gonna put you in charge of it, so here you go. I said, oh, okay, where's the instruction manual? What are we supposed to do? I didn't know, but I've learned along the way, and we've assembled the Alexander County Recovery Court Project with the assistance of every form of community partner, from the Sheriff's Office to Julie Walker, who is here, everybody in the county who has some role in this situation with the population. They are all active participants in the Alexander County Recovery Program. Now, why am I here today? It's the best of all possible things for this county commission. We're not asking for money, we're asking to help save this county money. What we're specifically trying to do, and you've had, I hope you've had an opportunity to review the abstract that Julie prepared, as well as some other documents. That kind of gives an idea of what we're about. It talks about our history. We are one of 2 projects that have come about as a result of the SUDS committee. The first project being Port, second being the Recovery Court. Our goals are set forth in that abstract. We want to do a lot of things. They're not minor goals. But what I want you to know is this isn't a program where we are aiding and abetting drug use or excusing it. This is post-adjudicatory referral. That means after it's already gone to court and after the adjudication of guilt has been established, then we're in the dispositional phase, what normally we'd call a probationary type period. And so there's it's a program with teeth. It has the ability to use leverage, the leverage of the penal system, to help persons who want to recover from substance abuse related issues and criminal behavior. What it is, that's what it's not. What it is a program which will assist in a number of areas, reducing county costs, reducing crime, preventing fatalities, both from the standpoint of the drug user and the innocent bystander. I mean, every time we come home at night, who is that person on the road with us? Did they just get done using fentanyl or something like that? Can they see? Can they drive? We are just as likely to be a fatality as the individuals who use these controlled substances. And then ultimately, what our goal is invigorate people to be the persons that God had intended them to be all along. Hardworking, tax-paying, law-abiding citizens who contribute to society.
Our program is premised on the guidelines that are promulgated nationally through the All Rise program. It's an evidence-based practice set of standards which uses clinically recommended, clinically approved, and clinically proven techniques to try to assist in these individuals gaining sobriety. Our problem now is that we have not the financial wherewithal to move forward. The federal programs, as you may know, the federal grants that normally we could have expected last year were pulled, and they've been subject to a number of revisions. That was last year. So we've waited, and then we had a possibility through a governor's or a state-based grant, which was the impetus for today. We learned about it before we could get permission, and we couldn't proceed because we didn't have permission. We're expecting these federally based programs to reappear probably in the next month or so, and we want to be able to be prepared and ready to apply for them. What we're hoping to do is, with your permission, to be able to apply for those grants and structure our program with some concrete funding so we can get underway and get our program started. You've got, I believe you may have some of the financial wherewithal items from, I know Burke County, there was an attachment that I had for Burke County, and that kind of gives you some of the financial figures that are involved and where these grants are so critical. What we want to do is get external funding to make this, make this funding a reality. We want to reduce the possibility that costs will accrue to Alexander County. Ultimately, our goal, once implemented, is to really save this county money from the standpoint of not having that sheriff so often at the Walmart, not so often at other places that they're well known to be. That's the ask. That's why I'm here. That's pretty much the sum of the program. I have some ability to answer some questions, but Julie Walker is here, who's my phone a friend in the event that we should need it. She can answer just about any technical. In fact, I've never seen you unable to answer any question you posed during these our meetings. She is very integral to our overall program. So at this point, I'll just turn it over to any questions that the commissioners might have about what we're doing, what we hope to do, and what we would expect.
How much are you looking for in getting this grant? What are you looking at?
Julie, based on last year's, well, what would have been last year's figures, what do you estimate would be?
If you don't mind, please, if you'd come up here, because if you answer it, they can hear you on the mic and they can't hear you back there. And also, I want to correct something a while ago. I said 12, but it's 32nd judicial district.
Yes, 30.
Yes, I said 12.
We've changed judicial districts, and we're now the 32nd.
32nd judicial district, yes.
These federal grants come in anywhere from $750,000 for a 3-year type stint into $1 million for a 4 to 5 year. And so, and then we did put the budget, this was just a sample budget of where Burke County came in under their last grant proposal. I'm with the Cognitive Connection. We are a treatment provider. We actually are conducting treatment for 4 recovery court programs in Catawba County. We are the treatment provider team member for Burke County. Caldwell County just opened up their recovery court. We're the treatment provider team member. And then I've been with Judge Young and the Committee for Recovery Court here in Alexander, plus the SUD Coalition for over 2 years. But these grants really come in and really look to layer in a lot of what the budget expense would entail. But the other important area of this is how you strategically look at that budget. So for instance, a treatment provider that comes in that already has access to bill Medicaid through your managed care organizations and or also state funds, you can offset that money into that pocket of funding with that provider. So when you look at this, you're not seeing treatment dollars, you're really seeing some of the cost associated with barriers. And part of that is like transportation, medications, like if they have behavioral health and/or physical health issues. It could be also anything from housing. And so a lot of the funds that you'll see in this budget are really looking at what are the barriers in reference to someone not able to even move forward with the treatment program because they're so consumed about how they need to live and provide for them and their families every day. Another big piece to these recovery court programs are employment. And so a lot of what's incorporated within the treatment program is looking at what their employability goals are and working with them for employment, moving into that recovery lifestyle. And then some of that may even them looking at trade school or going to a community college. So it's really enhancing the livelihood of these members into that recovery element.
Mr. Chairman?
Yes,
just like
sir.
There was one thing that really jumped out on me. I know I have it on my computer, and I think y'all have it in the background. Do you have access to that, Mr. Young?
To the,
Yeah, there's like the first 3 sentences of that was really interesting to me. The cost of drug-related crime per resident.
yes.
Could you
And
read
you're,
that?
we weren't certain if you were talking about the abstract or the budget.
Yeah.
Yes, the cost to the county is quite significant, and that, the previous speaker alluded to that, and it is a real factor. We pay that price every day as a result of people who have gotten in that substance abuse cycle.
Yeah, I think, well, it says here, I'll just read it. It says Alexander County has a higher statistical rate versus other counties of the same size for drug-related crime. Crimegrade.org reports the cost of drug-related crime per resident in Alexander County is $42 per year, which is $19 more than the national average. So, you know, that, when we hear it on the radio and you read it in the paper, you know, things do cost money, so, but,
Right, and $42 per year may not sound like that much, but the next sentence says, this totals the estimated cost of drug-related crime in Alexander County to $1.533 million per year. 7 digits gets my attention.
pretty big chunk.
And that's money that can't be put toward
Yeah.
the things that enhance the experience of persons in the county, the positive things. We're paying for eliminating or mitigating criminal activity. Not to say that that'll ever go away, it always will be there, but this is an amplification. And it detracts from the experience that people have living in this county. We want them to have the best possible experience. So eliminating some of those numbers, if, it would be ideal to say all of those numbers, but some of those numbers, reducing that figure by even a percentage is going to enhance
A lot of
what
money.
Alexander County can do for its citizens otherwise.
Thank you. We need a motion.
We do. Now, I was gonna ask one more question. Is
Yes,
there,
sir.
what's the ratio on the on the grant? Does the county have to put up money? Or is it like, 750,000 to 150,000? Is there a ratio that happens to come in there? Or is this-
Normally, there's a 15% match.
Okay.
And that can be discussed between the county and then the team. I'll give you, for example, like in Catawba County for the Adult Recovery Court Program, because we have a facility there, we actually, as the treatment provider, can do some in-kind match, and that will count towards that. So you will actually develop some additional resources here that actually could move towards that in-kind match that wouldn't really come out of directly from the county. So there's strategically ways in order to move through that.
Right.
The other big part I'd like to say, whenever I say develop more resources, that is one of the biggest contributors in reference to people not moving forward to even access treatment is because access to care, because of Medicaid reform and all of those things, the standard care plans, the tailored care plans, Medicaid, uninsured, private insurance, it's harder now in order to understand how to navigate and how to access resources, not only for what we call brain health, behavioral health, but also physical health. So a big part of what we've been doing with the committee and the SUD coalition is understanding what are the resources here currently, where are some of the gaps, but then how do we partner in actually improving and getting more resources here for overall health and wellness. And so this will actually help contribute to that.
Very good. Well, gentlemen, entertain a motion.
I make a motion to, I guess, to let them proceed with the ACRC goals.
Okay, there's been a motion to approve. Is there a second?
Second.
Motion's made and second. Any further discussion?
I do have a question. On the motion and the second, the request being made here this evening is they are seeking permission from the Alexander County Board of Commissioners to move forward with applications. So I assume if they are awarded a grant, it will then come back to us for approval, and we will know if there are any matches at that time?
Absolutely.
Okay.
This is just to explore.
This is just
and
the
get-
exploration,
Yeah.
put the fishing line with bait
Right.
in the water.
Mr. Chairman, one other discussion item. Our sheriff's department has a pretty darn good app. If you don't have it on your phone, there's a lot of information, and just be real honest, I get on there to see who I know and who I went to high school with that just got arrested. And if you click on, an inmate, it tells you what they were charged with. And it is meth, controlled substance. I mean, it's unreal. It's just crazy to me. The people that you would never dream, have gotten mixed up in it. And that's one of those things, someone said to me one time, nobody ever tries a recreational drug or something like that, saying, hey, I want to be an addict. Nobody ever does that. It's just, they make a mistake and they may end up paying the rest of their life, and very well pay with their life for that mistake, so.
Well, gentlemen, we have a motion and a second on the information on this abstract, court abstract. So if there is any other discussion, all those in favor indicate by raising your right hand. Those opposed likewise, motion carries. Thank you very much.
Thank you so much.
And make sure that when, through all this, make sure you get with the county manager and sit down and talk with him so that we'll have all the information as it progresses through.
He will be included on our monthly meetings. I know your plate is stacked to the hilt. I understand, but we're going to invite you to every meeting. We have them monthly, and so I'll get your email and you'll be notified.
Appreciate
Because
that.
we really would love to have you.
Absolutely.
Thank you all.
Thank you so much.
Yes,
and you
sir.
have a good evening.
Thank you, ma'am. Item number 10 on the agenda, budget ordinance amendment. Number 24, County Manager, Mr. Justin Mundy.
Thank you, Mr. Chairman. There's just one budget amendment request before you tonight for your consideration. That is Budget Ordinance Amendment Number 24. This is to budget for Round 2 of grant funding from the NC Department of Military and Veteran Affairs. The grant was approved in February with an expenditure deadline of June 30th, 2026. The grant scope of work includes $7,500 to reimburse salary expense that is already included in the budget, with the remaining $12,500 in a separate grant expense line item. It's also to increase the senior center budget for a senior Medicare patrol grant from the Senior Health Insurance Information Program for fraud prevention activities. And this does not affect fund balance. It's actually a decrease in fund balance.
Yes, very good. Gentlemen, entertain a motion at this time.
Make a motion to approve the budget amendments as presented.
Second.
Motion is made and second. Any discussion? All those in favor indicate by raising your right hand. Those opposed likewise, motion carries. Item number 11, consent agenda. Justin Mundy, County Manager.
Thank you, Mr. Chairman. So tonight on the consent agenda before you, we have some tax abatements and adjustments and tax refunds for January 23rd through February 22nd, 2026. We have the minutes from the February 2nd regular meeting. We have some board committee appointments. We have a line item transfer report for February 2026. And we have some requests to surplus a 75 Chevy dump truck, 1986 Chevy 3500 dump truck, a 2000 Chevy 3500 truck, a homemade trailer, a 2014 homemade trailer, a 2024 Iconic Elements truck bed storage box, a 2012 Ford Focus, and miscellaneous blowers, weed eaters, and other groundskeeping tools.
Very good. Entertain a motion to approve the consent agenda.
Make a motion to approve consent agenda as given by county manager.
Motion is made. Is there a second?
Second.
Motion is made and second. Any further discussion? There being none, all those in favor indicate by raising your right hand. Those opposed likewise, motion carries. At this time, we will adjourn the Alexander County Board of Commissioners meeting at this time. And I think what we'll do is take about a 5-minute break, and then we'll go into the public health report and the DSS report and the senior center report. So if we could take that 5-minute break, because I know there's a lot of folks that don't like to stay for these next meetings. You're welcome.
Thanks for coming. Oh.
Thank y'all. And then our meeting will start right up.
Hey. I don't remember that. Maybe I wasn't there yet. 'Cause I wasn't there very long. I flew up Sunday and came back Tuesday.
That's what my wife told your wife, something about, the weather and stuff. She said, kind of like my wife. If I'm
Well, I say it snowed. I mean, it did. Well, see, like I say, I had a bunch of crap going on. I just couldn't, So I flew up Sunday morning. Got there about 12:30.
oh boy.
Little Smokies and a blanket. Yeah, I guess you have cheese. Little Smokies in the, there's my dinner. Little Smokies. Go ahead. Pig, yeah, Little Smoky pig. They'll be cheese. There's 3 in there. That's all processed.
This is the Alexander County Consolidated Human Services Board meeting, and the agenda as presented to you, gentlemen, I'd entertain a motion to approve the agenda as presented on the commission, the Public Health Report, DSS Report, and Senior Center Report.
Make a motion to approve agenda as given.
Second.
Motion's made, second. All in favor, say, raise your right hand. Motion carries. At this time, I'd like to call on Public Health Report from Billy Walker, Health Director.
Good evening. I'm here to give the public health update. I'm going to do the organizational update, the financial update, the accreditation update, and some situational reports. On the organizational update, I'm going to go over the current vacancies and some staffing updates. So on the current vacancies, on the advisory board members, we are looking for ophthalmologist, and Macy Jones resigned, and we will be replacing her in July. So we will need to replace that one. That's the public member position, so let the community know that that's available, and we'll put out that on our board and our website as well. In-house, I'm gonna go ahead and take off that the dental health, the school-based coordinator, she started today, so that's no longer available. The LCSW, that did post, so we started that back. And then we have an unpaid intern position. I'm not going to read all the financial updates, just to let you know that we are working on our budget in-house, and we've met with the county manager discussing the health department budget and the needs, and then we've turned in our technology request. Fee approvals, this does require an approval from y'all. We are going to change some of our verbiage. We had a state consultant coming in, and I'm always coming and asking for you to approve a change to a fee here or there. It could be a couple cents, it could be dollars, and they're recommending that we add the verbiage below that after we get a fee approval for the whole year, that we only come if it's not on the fees. We don't have to come every single time. And it just saves us from having to come or send you the paperwork, because if it's going up a couple dollars or going down a couple dollars, it's not worth me coming for approval. So below, you'll see the verbiage that we're asking you to approve.
Gentlemen, you see the request that has been made. I'll entertain a motion to approve.
I make a motion to approve the verbiage as stated in our report.
Do we have a second?
Second.
Any discussion? There being none, all those in favor?
So I would just say that increases responsibility on you guys,
Oh, yeah. Mhm.
you know?
Yeah.
And
It's basically what the state's passing down to you, or their insurance companies are passing down to you
Oh,
all.
yeah.
And you're
Yeah.
just moving in there so you can still maintain the same coverage without
Right.
any cost to the county.
Right. Yeah.
But we think you do a good
Yeah.
job, so.
The motion's been made and seconded. Is there any further discussion? If not, those in approval, raise your right hand. Those opposed likewise, motion carries. Go ahead, ma'am.
Okay. So the next one is the, what we're recommending for 2026 fees. These will go into effect in July, but this is what we're recommending. So we meet with our management team, and we go over, we request from other local health departments and environmental health what their current fees are. We also get like Medicaid, and then private practice, what their rates are. And so we sit down and we look at what Quest and different lab prices are, and we'll do calculations, and we sit there and we do math all day long and try to come up with something that's gonna work, and not break the bank for the health department, plus be able to be affordable for the county as well. So this is what we're recommending. We don't really have a lot of changes in the clinic, and I'll go through and try to explain some of the ones related to what we're adding. Environmental health is just changing a tad. He's trying to get them caught up. We went years without increasing environmental health fees, and so what he's doing is just increasing them a little bit at a time, just to try to match what other fees in the surrounding areas are. But if you go to the immunization pieces, those are fees that have gone up, and we're just trying to match the insurance reimbursement pieces. And so that's what we're asking for in that second box. If you go to the next slide, we are not increasing anything in the behavioral health, the general health, dental health, but in lab, used to you'd have a COVID and then an influenza, and they're two separate, and we're gonna join them. So we need to add that, just as a test cost. And then maternal health, we're no longer doing that right now, so we're not gonna take those off, we're just gonna gray those out. So when you look at our price list, it'll be grayed out. And I just wanted to explain that that's why those are grayed out. We're not gonna do away with them, because if we're hoping to get that maternal health piece back, but we do want that to be highlighted that, hey, we're not doing that right now. And that'll need approval.
Gentlemen, it's been presented to you about fee approvals, and entertain a motion.
Mr. Chairman, I make a motion to approve the proposed fee, environmental, health department fees as presented.
Motion's made, is there a second?
Second.
Any discussion? I noticed the other day I had to have a COVID and a flu test, and they combined them both. I mean, it's just
Yeah.
real quick. That's the only reason I knew about it.
Yeah.
okay? But anyway, it's a lot quicker and a lot faster and a lot
Yes,
better,
it
more
is.
efficient, more efficient.
Yeah.
All right, motion's been made. Second, any further discussion? There being none, all those in favor indicate by raising your right hand. Those opposed likewise, the motion carries. Thank you. Go ahead.
So the next thing is, I'm going to update you a little bit on accreditation changes. I know I've been telling you that it's coming. We're getting closer to it, and we did find out that they are going to make us switch to the new dashboard. So we're getting trained on that. They're going from a number system to a letter system, and we are going from 147 benchmarks down to 41, so we're thankful for that. But it's going to be A through K instead of numbers. So I have tried to go through and update some of these new slides with that lettering, so you'll see that piece. They are going to a site visit in person, and so the next slide will show you just the date range for this. We don't know exactly when we're going to be, when they're going to be in-house, but some of you will be asked probably to come in for interviews, but it's going to be August through October for us. I will say we are going to be the guinea pigs for that. We're not really looking forward to it because we're very prepared for the old way, and it used to be with honors, and now it's not going to be with honors. So the health department, the Health Directors Association has asked that they send a letter to let the commissioners know that that's why they're not doing the with honors. We don't want the commissioners to think, hey, that we've gone down in our status. But I don't know if they're going to do that or not, but we have requested that. So I just wanted to keep you aware of what's going on, and we'll receive our letter soon. And Katie's been getting trained on all the new changes, and we're at the top. So it'll be coming soon. Next slide. You received all your paperwork last week. It is time for our annual board training. None of you are new, so we didn't have to do the new member orientation. So this is just reviewing the paperwork. So you'll see that the accreditation numbers changed, and you'll see the G 3.1, G 3.2. So that's what I was saying about the benchmarks. But as our board, you have to have the annual training, and I'm not going to go through all those pieces of paper. I hope that you've reviewed those. But it's about being the operating board, our policy and procedures. It's the human service board and the advisory board member orientation. I did that in February when we had the advisory board meeting. And you'll have to sign that you did this meeting, that you did this training, and then you'll do the review guide. Now, the review guide actually does say 2026, but on here it says 2025, and I apologize for that. But do you have any questions for me? I think the next slide just talks about the policies that I sent in I think y'all got that in paper, yeah. Okay.
Any questions?
Good.
We're good.
Situational reports. I'm going to let Katie update you on the community health assessment and the strategic plan, and then she's going to talk about some of the community reports, and then I will close us up on the CFPT and what's coming.
Good evening, and thank you for allowing me the opportunity to come present the CHA to you. The CHA report is pretty in-depth. It's about 56 pages long, so I'm not going to present the whole thing to you. We'll just go over some of the highlights. Go back a slide. Thank you. The strategic plan is based off of that community health assessment, and since we just completed it, it's in its draft form now, so we'll present the strategic plan to you once it is complete as well. For committee reports, we do have Healthy Alexandrians, which runs that community health assessment process, our local information team, our SUD transition, which we'll get into some more depth about, and then CFPT and what's coming. So the community health assessment, it is complete. It was approximately 1.5-year process for the health department, so we're very proud to announce that we've submitted to the state, and it is now available to the public. They can look at copies online on our website, alexanderhealth.org, or you can get paper copies in person at the health department or at any of the 3 library locations. This year was This year was a huge success for us. Typically, we get a response rate of a little under 1%. We got approximately 2.5% of our population to respond this year, which was 1,101 what we call viable responses, which means they're Alexander County residents. We did have about 59 people respond that weren't residents, but we made a slight change this year where if they weren't a resident, the first question they were asked was, do you reside here? And if they did not, they were filtered out from the survey. So it kind of saved everybody some time there. And the excellent part of this representative sample, that means that our community health assessment actually reflected the demographics of our population. So the people we surveyed had the same age breakdown, demographics for where they live, gender. So we had a pretty representative sample, which is really what you aim for to show what your population is. You can go to the next slide. So one of the highlights of that community health assessment report is making sure we assess not only, what the needs are right now, but what's coming as well. And so, of course, as we have all seen, measles is one of the concerns in North Carolina. No cases in Alexander County yet, no exposures in Alexander County yet, but we are preparing because we've started to see huge increases in the last few years of measles, and it's creeping closer and closer. Next slide. Now, on the opposite end of that is we also like to report what we did well. We want to show the community that what we did in our last assessment actually had an impact, and we really did work on these things we said we did. So on the left side, that's an image of the renovated Bethlehem Park, which one of our last community health assessment had 5 priorities. And one of them was healthy living, which means physical activity and access to nutritional services. And so that was a huge win for Alexander County, was, of course, the renovated Bethlehem Park. So we want to see more things like that happen. And then another one, if you look at the chart on the right, is our number of overdoses responded to. And these are actually statistics pulled from our Alexander County numbers. These are our sheriff's office and our EMS pulling these numbers. And so you can see that we kept climbing until 2023, where we peaked. And then we'll talk about the programs that went into place that might have had an impact on that. But after that 2023 year, we've seen a gradual decline in overdoses. So that is a huge success for Alexander County. So another piece of the community health assessment is not just looking at the general community, but the members of the community who are at especially high risk. This is pretty similar to what our last community health assessment identified. So our adults and youth in need of mental health services, that's, as we know, is a huge one. Transportation is another one, our low-income population and our uninsured, and then our limited English population or non-English speaking individuals. One of the last sections of background information or secondary data that we pull is morbidity and mortality in the community health assessment. Of course, cancer and heart disease have been in the top 10, the top 2 trading places over the last 2 decades. The significant difference for this cycle's community health assessment, and I showed that graphic on the left for cancer deaths, was that pancreatic cancer was actually so high increase from our last assessment, it was pulled out and made its own chart, or its own piece of the chart. Previously, it would fit in with the other categories of cancers, but now it is in actually the top 5 types of cancers by death. And then for the morbidity portion, or what causes difficulty, a big one is obesity. As you can see, Alexander County, that chart on the right, we kind of closely follow the state, and we've recently started to surpass the state, 2023. During pulling this assessment in 2025, the 24 data was not available yet, but now it's available, and again, we're higher than the state in 24, and we're waiting on that 25 data. And then some more information about that top 10 leading causes of death. Again, heart disease and cancer, they have been our top 2 and the nation's top 2 for a long time. One difference for our top 10 leading causes of death in this community health assessment versus our last one was that diabetes has now creeped into the top 10. It's actually at number 8 now. Previous, we were at 11 to 12, rotating, and unfortunately, it's hopped in that very top portion of top 10. Okay, so how the actual community health assessment works and what we really want to see from it. Essentially, the long and short breakdown of a CHA is that we pull every bit of secondary data we can, so what's already out there. And then if there's missing pieces, we do primary data, or we pull our own data, which is what that survey and those 1,101 responses came from. And then because we missed a little bit, we had a few more females respond than males to our assessment, we decided to supplement with a male focus group, just to make sure it was completely representative. So we pull all of that data, and then we analyze it. And we present it to a board called Healthy Alexandrians. And this is a public board that during the CHA process meets once a month. And essentially they look at all this data. They assess not just what the community needs, but also what the community wants. These are members of the community and leaders in our community. And then based off of all of that data and all of that discussion, we decide, or the Healthy Alexandrians Task Force decides, what priorities the health department needs to focus on. And we do that, again, through looking at that data, looking at the needs, but also looking at the wants. So the 2025 Community Health Assessment priorities are healthy living and mental health. And again, that healthy living is essentially just physical activity and nutrition encompassed in one category. So the last bit of data is just breaking down what we've found from those priorities. On the left chart, you can see physical activity in Alexander County. And we pulled something called a walkability index score. Sounds kind of complicated, but really it just means, can people walk or bike from place to place in Alexander County? Not very easily, we're very rural. So our walkability index score is not very high, we're very low compared to the state. However, compared to our peer counties, we're pretty much on par. For this community health assessment, our peer counties are Burke, Caldwell, Madison, and Stokes, and that's for all information that we pull. Now that's what the data showed, but our surveys showed that 25% of our population, our adults, they don't get physical activity. And 15% of them said that they don't exercise because they're too tired or don't have the time. I don't know about y'all, but even with that walkability index score being kind of on par, 25% of our population not exercising is a huge amount. And all of the things that come with not exercising.
Like heart disease and obesity.
Exactly. Chronic diseases. So then on the right side, when we look at access to food, the other piece of healthy living, again, we kind of see in our data that we're, for our low income population with low food access, we're actually kind of below our peer counties, which means we don't have as much difficulty as our peer counties. And then we're right around there with the state. But then again, we look at what our community actually wants, and again, 25% of them said that they have difficulty getting fresh fruits and vegetables because it's too expensive. And so that's where we kind of, in this community health assessment, really pull, yes, the data, what are the needs, but also what are the wants. And then the mental health priority. This one is a need and a want, very much so for Alexander County. That chart on the left, that graphic, it shows the average poor mental health days per month. Essentially, Alexander County is on par with our peer counties, and again, above the state. So our people are having more poor mental health days than the state average. And then the one that's really hard to look at, the emergency department visits related to suicide or self-harm. And I don't know if you can really see the right graphic very well, but that dark blue line that's above all the other lines, that's Alexander County. So our emergency department visits for suicide or self-harm are unfortunately, statistically, so much higher than other counties. We did see a small drop in 23, but then 24 we went right back above to our peer counties and the state. It's hard news to take.
Was that broken down into age group?
So this is per 100,000 age differential, yes.
Okay.
So it's kind of like an averaged.
Right, okay, thank you.
And then the last piece of community health assessment, like I said earlier, is that strategic planning. So we know what our priorities now, we know what the committee wants and needs us to focus on. And now we go back to that Healthy Alexandrians Task Force and we ask, what programs do we think we can implement and how are we going to go about actually doing this? And the last thing for our committee reports, of course, we've got that Healthy Alexandrians Task Force. We are planning to meet this month to start our strategic planning and our community health improvement planning, trying to work towards changing those trends. And then our SED coalition. So we saw with that statistic for overdoses that this has been a significant downward trend now in the last few years for overdoses. Doesn't mean it's no longer a problem. But since our community health assessment did not identify substance use disorder as a health department priority, the SED coalition will no longer continue to meet at the health department. Back about 2014 was the first time we identified substance use as a priority, and it continued every community health assessment through 22. Now, something really great happened in 2023 with those opioid settlement funds. That SED coalition helped develop the PORT team, or helped plan that PORT team. So now the PORT team is very well equipped to lead this type of work. So the health department is able to essentially hand over that SED coalition, transition it to the support coalition with Alexander County PORT.
So, saying all that, I think we've done great work on the last CHA, accomplishing the goals that we set forth for the last 4 years. So going forward, we can work on the goals that have been set in place for the next 4 years. And like Katie said, she's had to submit that to the state. The CFPT, that's the child fatality team. I'm just gonna let y'all know that the state has changed that, and I think we came in 2 meetings ago and we discussed that. And the state has given some funding to the health departments for that piece as well. The paperwork has changed. It's a little more in-depth than it was. But that's just a little bit of change that's happened with that piece that we'll be doing. And we'll still have to come and do that report for y'all as well. What's coming, Katie has a lot coming up, starting now, and when school starts. So I like to tell you what she's gonna be doing every time I come. And that's it for us. Any
I have a
questions?
question. On the emergency department visits related to suicide and self-harm, I'm assuming you pulled that graph off of the state, more than likely?
So we were able to contract with Della Ray Consulting this cycle, so they created our graphics, but they pull all of their data from NC Data Portal, which works with US Census Bureau, NC, DHHS, and the CDC.
I was looking at our graph line, and it looks like in 2022, it shot down, declined, and then in 2023, on the same angle, it came back up. Was there an event or anything that occurred that
I wish I could say.
caused this?
And we could ask him,
And how many numbers are we actually talking about?
We'd
That would
have
be
to
neat
get
to
the
know
data from
an
him.
actual
So
number.
it's per 100,000, and since we're about 36,000, they like increase the numbers to match that 100,000. So we can get the actual numbers, but then it's just showing the rate per 100,000. But we can grab the number.
The only reason I ask, I'm wondering if we're in single digits or, you know, monumental digits, that's all.
Would it be, I mean, if our, this is maybe silly math, but if we've got 30-some thousand people, that's about a third.
36.
That's about a third of 100,000.
yeah, we could get the
I mean,
the
I don't
actual
know if
numbers
that's- I don't
for
know
you.
if you could kind of,
I'd actually like for you to send that out. if you
yeah,
don't mind.
let me estimate it based on
And
that.
we do have what's called scorecards. So if you just Google Alexander County scorecard and you look at our 23 to 26 cycle, it'll show each one of these things like populated out for the overdoses, for suicide, for mental health rates and those things. And you can see like the trends per 100,000 plus the actual physical number.
But I can get those to Jamie and she can send them to you. Any other questions?
I was a little surprised pancreatic cancer went up.
Yeah.
Is there any reason? Do we get it?
I don't think that, no, mm-mm.
I know that's really strange, because that's one of those that just sort of slips up on
Yeah.
you, you know?
Yeah.
And by the time you find out, it's usually too late.
Yeah,
It is. Thank you, ladies.
thank you.
Good job. We appreciate the presentation. At this time, we're calling for our DSS report. Carrie Gerald, DSS Director.
Good evening.
Good evening.
I'm going to bring a few updates concerning HR 1 at the end, but I'll talk about our vacancy rates and what we have going on in DSS. So right now, our vacancy rate over the past month is 11%. We're still seeking qualified candidates for child welfare. Adult Protective Services, that position has been filled, and we're seeking applicants for economic services. We're also looking for volunteers for our Meals on Wheels program. So if you know of anyone who is interested, please contact Kay Daybalt, and her number is provided, 828-352-7664. We have had 3 new hires for CPS and 2 for economic services. There are 47 children in DSS custody, 6 children in the LINKS program, and there are 3 children in the 18 to 21-year-old program. We have 6 foster homes in Alexander County. 3 are in the process of being licensed. We have 4 adoptions that have been completed and 3 adoptions that are pending. For Adult Protective Services, we have 14 wards. Adult Protective Services has also the OASIS program, and that's a database where they are now able to submit some of their forms through. They're hoping at some point, maybe within the next 5 years or so, they're hoping to have that to be able to do their document management as well. For foster care, May 2025 through January of 2026, we have reunified 2 children. 7 families have been granted guardianship. We have received 9 relinquishments, and that's where parents just sign over their rights to the department or to the foster parents. We have closed 3 cases in court. We have been relieved of efforts and changed the plan to 6. There's 6 that we have relieved efforts and plan change. 3 of those children are in adoptive homes. Pending relinquishment scheduled, we have 5, and these children have been in our custody since 2019. Next court date, hopefully, we'll have 1 closing. Now for the HR 1 updates. Commissioner Lell provided some updates, and I'm grateful for that, so I'm just going to talk about what he has already spoken about earlier. Effective October 1st, 2026, the reimbursement rate for all food and nutrition service workers will be reduced from 50% to 25%. We, the county, are responsible for 75%. Work requirements for all able-bodied adults without dependents, ages 18 to 64, and parents of children over age 14, that's the new work requirement now. These individuals will have their benefits terminated after 3 months if they do not meet these new work requirements. This will most likely cause a lot of new applications, therefore causing caseloads to rise. It will also put an increase on our food banks and pantries because there are some families that will lose their benefits. Households with an elderly or disabled member who receives the assistance from the Low Income Energy Assistance Program, they will automatically qualify for the heating and cooling standard utility allowance. Payment error rate, and this is very important. The state and the feds have stated we must stay under 6% error rate for food and nutrition services. If we, not just talking about Alexander County, but all 100 counties, if we do not stay under that 6% rate for a consecutive time frame, we could be in jeopardy of losing food stamps in North Carolina. So the Medicaid administrative reimbursement rate has not changed. That is still 75%, and the county is required to pay 25%. There will be new program requirements, the work requirements, and that will become effective January 2027. And the review period will be twice a year. I'm not sure if you have heard about Medicaid centralization yet. That's something new that the lawmakers are talking about. And what will happen is if they remove Medicaid from the local counties, the state will pick it up. But you lose that connection when people come in the office and talk with the worker one-on-one. There's not a lot that we know about Medicaid centralization. The state nor the feds have given any, the state hasn't provided any guidance on that. So that's something that we're watching. And when I find out more about it, I will be back to talk with you further about how it may or may not affect our county. Any questions?
You can about rest assured it's going to affect the county.
It will.
Mr. Chairman, I have a question. On our DSS, could you put together a list of the required services that the state requires for us to cover in our county and the expense for each one of those by chance?
Okay.
And then also provide a separate list of non-required services and those expenses?
Okay. Okay, I can do that.
And then also on the vacancy,
Yes.
I think it was, what, 11%, but you'd filled one maybe?
We have filled one in adult protective services, and I believe there is one that has been filled in child welfare, is two that have been filled in child welfare as well.
So on the vacancies, or is it the same vacancies we keep carrying month after month?
Yes.
So who's making up the difference there?
We are. Social workers,
People in that department or folks multitasking with multi-titles? How's that coming together?
exactly. So, I myself, if I have to carry caseloads, I will carry a caseload. The social workers are carrying a lot of different roles, multitasking, like you stated. That's what we're doing.
All right, so if you have to carry caseloads yourself, being director, then you do, you said.
I do.
So are our department heads efficient in the employees that are underneath them to do their jobs efficiently?
Are we efficient to do a
Not,
social?
not you specifically, but I guess the supervisors or folks that have employees under them, if they're jumping in there to take those caseloads or whatever and wear those hats, are they efficient to do so?
Yes,
Okay,
yes.
all right.
Because we've all gone through the same training. We have to go through pre-service. And that's where, now back in my day, it used to be like 7 or 8 weeks. They've reduced it now, it's like 4 weeks of training. And that's where we go and we learn about foster care, in-home, assessments. You learn about the different areas in child welfare.
Okay.
Mr. Chairman, just have one question for
Yes,
Ms.
sir.
Carroll. You had mentioned the ERA rate, like 6%.
Yes.
You know, if it goes up. Do you have any idea do we have an error rate right now, or what is that?
We do have an error rate right now. I'm not sure of what it is. We had an error, I believe, a year ago.
Well, no, I haven't seen many come, through us,
Right.
so,
We weren't audited.
okay.
So there are some DSS that have no error rates right now.
So we're under that.
Oh, right
well
now,
under
yes,
that
yes, yes,
6%.
yes, yes.
Okay,
We're under.
all right, thank you.
Along those lines, what constitutes an error? I mean, somebody being paid benefits that doesn't qualify?
Right, you're paying either too much, you're giving back too much, or it's too low.
Okay.
You're missing, you're not paying attention to key details.
Right, okay. But it's somebody is either being paid too much, too little, or I say paid, they're receiving too much or too little, or someone's receiving benefits they shouldn't be.
Correct.
Or, okay. I have one other question about foster care.
Okay.
So we have 47 kids in custody, per this. How many of those kids are housed out of county, roughly? Or, I mean, that may not be something that, because I'm just looking at it,
The majority.
6 foster homes can't hold 47 kids.
Right, right.
And it costs more for them to be out of county.
It does.
Right.
It does. It does. And we have a lot of children who are therapeutic.
Right.
And we don't have any therapeutic homes in Alexander County. And all of us surrounding counties, we're fighting for the same homes that are nearby.
Okay.
Anything else?
Thank you.
Thank you very much, ma'am.
Thank you.
Appreciate it. Our senior center report. Vicki Martin, Senior Center Assistant Director.
The happiest report you got.
Yeah. Dance, or-
Good evening. I'm not Christie, and I'm not as peppy as she is, but I'll try to keep it light and flowing. How's that?
That's good.
We are growing. Every week now, we are adding more people that are coming to the senior center. I'm not supposed to ask for a new building while we're here, but just keep it in your back of your mind, because we are growing. We have added, each time that we have a new class to get going, right now we've added the class for our, one of the popular ones, dance aerobics. And we have 90-year-olds that come to this class. You can do it sitting or standing, but you can see in the pictures, all of those are standing. And they are loving this class. We're also doing the tax preparations, AARP. They have added more appointments because we filled up all the appointments that they had. And this is really a wonderful thing that our seniors have, is to be able to go up there and get their taxes done, because it's expensive to get them done. So it is a wonderful benefit, and we're very thankful for that. Our Bethlehem branch is growing as well. They have grown 4.5%, and that they're increasing with the things that they are doing over there and the people that are coming. The pictures that are there, that is where they had a Mad Hatter Tea Party, and they did their own hats. Some of them made the hats, and they just had a wonderful time. And if y'all ever have a day that you want to come and just enjoy the day with them, anytime, come and just see what they're all about, because they enjoy life and they come out there and have a wonderful time. The Bethlehem branch is also offering hearing screenings, and the mammogram truck is going to be coming back, and we'll have it at Bethlehem first. And all of those will be in, all the dates and times will be in the newsletter. The Stony Point, if y'all look at those pictures there, those are all painted by our seniors. We have a lot of talented seniors in this county. I mean, those are beautiful. And that's what we decorate our walls with at the senior center, is the artwork that they do. But they have started at the Stony Point having a card day. So they are now playing cards on Mondays, and then they're doing their painting on Tuesdays. So that center is growing as well. The Senior Medicaid Patrol Grant, our S&P grant, was increased to $16,800 this year. We've already planned a shred event, and that's going to be March the 27th. Operation Medication Drop will also be there on March the 27th with us. The Sheriff's Department will be there for that. And the Alexander County Health Department will set up a table, and they'll have information out for our seniors as well. The Musicians Jam, that's on Mondays, and it's also on YouTube, so if you ever just want to listen to them, just put it on your YouTube and listen while they're playing. They are wonderful. They are really, really wonderful. Today, they were in there just going to town. Some of them getting up dancing, and it was just a very good time. But it's growing along. May 17th, that is our senior celebration, and that's one of the days that everybody looks forward to. So, some of us are a little older than others, so you might have some 70s stuff at home. So if you got your glasses from the 70s or your friends you want to put on and come on out. We're going to have this. It'll be in conjunction with our Unifor Senior Games that we're taking the applications for right now. They're due by the 17th of March. And we'll have our fun walk to start off, to kick off our senior celebration. We will have a DJ, we will have food, and we will have games and entertainment. That one's gonna be on May the 17th. We have our day trips set up for the first part of the year coming up. We're gonna do the Moravian Cookies, Cody Creek, the Pie Company, Billy Graham Library. They've got to do it in a new one this time. It is the Hot Glass Alley, where they do blown glass. They're going to be doing the Arboretum, Greensboro Museum. They start on the 10th of this month. They'll take people to come in and sign up for them to go, and they will fill up fast. Some of the upcoming events that we've got coming up, I mentioned the uniform games, the Unifor Senior Games, and last year was our first year at having them come here to Alexander County. So we had people from Iredell County, Alexander County, Catawba County, and Caldwell County that came in to participate. This year we're going to do, on May 1st, we'll have it again. We'll be playing hand and foot, rook, and they'll also be doing the Mexican train dominoes. So we'll have people that'll be setting up to come in, and it's just pulling more people in. So you know they're going to like our center better and want to come, so we'll be growing again. Bethlehem's going to have a Derby Day. That's going to be the last day of April. They're going to have, Brookdale's going to sponsor that, and the Taylorsville House for the food and the decorations. And I already told you about the mammogram truck that's going to be coming there. Upcoming events, the spring classes, we're going to have a garden class, and that's going to be May the 17th, where they get to take home their tomatoes and cucumbers, and usually they plant the lettuce around it as well. But those things they'll get to take home to grow. We'll also do our make-your-own tie-dye T-shirt, and our summer sale will be in July. That'll be the 11th, where we'll do the craft fair, the yard sale, the farmer's market, and we'll have all of that at the senior center. Our next overnight trip. This one is the Treasures of Ireland, and I'll let you know when I get back how wonderful it was, because I'm going. But this one's going to be, we'll leave September the 26th, and it's a 9-day trip, and we have 12 that have signed up to go. And you don't have to be a senior to go on this one. Next is showing the increase in our Medicare. The next slide and this slide I'm going to tell you at the same time. The savings for January through December 2024, we did have a savings of over $1 million. And we had 1,364 contacts. And every time the phone rings and it is about Medicare, that is a contact, because you're going to stop and you're going to talk to them and help them. Even if it is a savings or not, that's your contacts. That was from 2024. 2025, last year, January to December, we had a savings of $880,156. We had 1,687 contacts. So we had more contacts. Part of the reason that our savings is down is Medicare they put a cap on the prescriptions. It's $2,000 in 2025. In 2026, it's going to be $2,100. But once they've spent that amount, then they don't have to spend any more, which I know that sounds like a lot of money, and it is, but some of the medicine could be up that high. So that's part of the reason our savings doesn't reflect it, but you can still see that we're still seeing the people. We're still having the beneficiaries come in to get the help. So far this year, January 2026, we have had a savings so far of $258,000, and we've already started with 86 contacts in the month of January. And then our participation rate. The average participation for January through December of 24 was 2,809 participants. January, December 2025, average participation was 5,791. That's an increase of 106.16% from last year. And in 2026, for the month of January, Our participation was already 3,703. That is 25.6% from the year before. Is there any questions I can answer for anybody?
Seems like everybody's having a good time.
They do have a good time. They do. Like I said, we have a lot going. We try to offer a lot for them, you know. We have a lot of information there for seniors. We have people call us from out of town, you know, I'm gonna move in your area. What kind of things do you do there? What kind of resources do you have? So it's just, it is more than just a building for them to come play in. It's a lot. It's a lot there for them.
Very good.
All right, y'all have a
Thank
good
you.
night. Thank you.
Have a good night. That will conclude our Alexander County Consolidated Human Services Board meeting. And this time we'll call on our county attorney, Mr. Ben Falconberry.
Good evening, Commissioners. This time I ask for a motion to go into closed session in order to consult with an attorney employed or retained by the public body, and also to discuss matters relating to the location or expansion of industry within the area served by the public body, including agreement on a tentative list of economic development incentives that may be offered, and to establish or to instruct the public body staff or negotiating agents concerning the position to be taken in negotiating the price or other material terms of a contract for the acquisition of real property by purchase, option, exchange, or lease. I do not anticipate any further action following closed session.
Thank you. Entertain a motion?
Make a motion to go into closed session as stated by our attorney.
Second.
Motion is made and second. Any further discussion? All those in favor indicate by raising your right hand. Motion carries. We will go into closed session, and we will come back into the regular session for adjournment only.